so much for inviting us to talk today. We're really excited to be here. Just before we get started, got a couple disclosures. So Brett had nothing to declare, but I just wanted to let you guys know that I got married on Saturday and I got back to Calgary last night at 11. So my legs aren't quite as sore as the ultra marathoners, but I might be just as tired. So just a heads up. Also, we don't have as pretty pictures as the cave talk. Diarrhea is not quite as glamorous, unfortunately, but here we go. So the purpose of our talk today is just to increase your knowledge surrounding common infections that could be encountered in the wilderness. I'm going to be talking about diarrhea and dehydration, and then Brett's going to be talking about wound infections. Neither of us are really masters of the field of either of these things, but we just want to share some information that we're able to find for you. So to start off with diarrhea and dehydration, I just want to teach you guys a little more about how to identify symptoms of mild, moderate, and severe dehydration and be able to understand how to rehydrate people in the backcountry, and we're going to go through a little scenario. So just to get you thinking, I want you guys to kind of read through this question, read some of these symptoms, and just think about how much of the total body fluid has been lost when someone has symptoms such as difficulty walking, dry mucous membranes, elevated heart rate, low blood pressure, confusion. Anyone? Greater than 10, yeah. So this person is in serious trouble. Their level of consciousness is impaired and they've got some vital instability. So this person needs to get to a hospital as soon as possible. So the reason that I'm going to talk about diarrhea today is because this is a really common cause for people to have severe dehydration. When you're in the backcountry, I heard that people were doing the water purification thing yesterday. So there's a lot of organisms that are found in water that can cause dehydration. You can also get diarrhea from microorganisms found in undercooked food. This can wreck your day, it can wreck your trip, and it can also put your life at risk if you get into a serious situation. So, I got some messed up slides here. But anyway, so the first just key point is that you just want to avoid getting sick altogether. So with sanitation, make sure you're burying your poop when you're out in the woods, as well as making sure you're washing your hands. Some of these bugs are resistant to hand sanitizer, so you want to make sure you bring some soap with you on the trip, that you're washing your dishes, washing your hands before you cook, and just being, common sense. What we're mostly talking about today is things that are found in the water. They're bugs that are found in human and animal feces, and they get into the water system around here. So there's a couple different ways that you can purify your water. The thing that works the best is boiling water. You can kill all the different types of microorganisms that we see out there. So the three main ones are protozoa, bacteria, and viruses. If you're boiling your water, you want to be boiling it for a minute. Rolling boil, and that should get rid of pretty much everything. That's at sea level, so you have to take into consideration a lower boiling temperature when you're up at altitude. So if you're above 2,500 meters, you're going to want to do it for over 3 minutes. There's other things like tablets or things like Pristine, so using chemicals to disinfect your water. These are great against bacteria and viruses, but protozoa like Giardia and Cryptosporidium are things that are not going to respond well to these types of methods. So if you're going to do that, you might want to combine that with using a filter, which is also able to get rid of those things. Filters aren't very good against viruses. Viruses are tiny, and the filters aren't going to do a very good job. So using like Pristine or iodine in combination with a filter is the way to go if you're doing that. There's also these UV pens that you can use to disinfect the water. This can only really be done in water that's clear. So if you can filter the water first and use that, that's great. There's not a ton of research out there on the UV pens that I was able to find yet, but so far it's looking like they're pretty promising. They're just a bit expensive, so if you're looking to save a bit of money and you have the time, you boil your water, that's kind of the way to go. So first bug that I'd like to talk about is Giardia, so you may know as beaver fever. This is a really nasty one that lives in the water in the Rockies because it survives super well in cold water. Luckily, half the people that ingest the Giardia, which is a protozoa, so that means that it's in a little cyst and it's very, very hardy. Lots of people that ingest it will actually clear this infection without any symptoms at all. So some people on the same trip, some might get symptoms and some might not. The main symptoms are diarrhea, as well as burping, vomiting, cramping, bloating, feeling generally awful, foul-smelling stools. I know stool usually smells bad, but like really bad, as well as weight loss and dehydration, because this you can have symptoms for a very long time. Burping is one of the ways that you can actually tell that you might have Giardia compared to something else. Most of the other things don't actually have that symptom. An interesting fact about Giardia is that you might not actually start getting symptoms until up to 2 weeks after you've ingested some of these bugs. So you might have gone on a trip 2 weeks ago and get sick on a different trip a few weekends later. Most people are able to clear this infection on their own without the help of any antimicrobials, but you might be sick for a very long time. So if you're experiencing these symptoms, you want to go and get some antimicrobials like metronidazole. Boiling and filtration are going to be the best ways to avoid getting sick. The filters at places like MEC and stuff should tell you that they're less than 1 micron and that they're good against protozoa. So you want to look for that when you're buying a filter. Another type of protozoa is called Cryptosporidium. It's quite similar to Giardia in the fact that it's really hardy, makes you sick. It can give you the diarrhea as well. It also can affect your gallbladder. So there's some long-term consequences of getting sick with this. And for that reason, if you're having really bad symptoms, you do want to go to hospital and get treatment as soon as possible. Or go to your family doctor walk-in clinic if you're having long-term diarrhea. This one can be transmitted from person to person and animal to person. So if you're out there and you're having encounters with wildlife, or even if someone's got their dog on their trip and that dog, you're not sure where they're going to the bathroom, that's something that you really want to be paying attention to. Again, boiling and filtration is what's going to work the best against these protozoa. So the bacteria causes of diarrhea out in the wilderness, there's a whole bunch of them out there, but this is what's known as traveler's diarrhea. So if you're ever traveling to, for example, Mexico or Asia, South America, you often will go to the travel clinic and pick up some antibiotics to protect yourself against this. A lot of people have experienced it when they're out there, so you can also get it in our water too. So you're going to get sudden onset diarrhea. This is going to happen pretty soon after you've ingested something that's contaminated, as well as vomiting, cramps, dehydration. Your symptoms are a little more short-lived, but can last up to 2 weeks. And you can prophylactically prevent it by taking antibiotics if you're in a place that you think, this is going to be a place I'm going to get sick, or you can take antibiotics after, and you usually only need you can do 1 dose of azithromycin or a course of a few days. The difference with the bacteria is that the filtration isn't very effective compared to disinfecting with chlorine, iodine, or something like pristine, or boiling. So you need a very small filter for that, this one, and this is where it might be better to try, if you're in a place that you know that this kind of thing is in the water, you might want to disinfect and filter. And finally, we've got viruses. So you guys are, I heard saying that you only need 1 virus to get sick, so that's, yeah, a rotovirus, yeah. These viruses are incredibly contagious. I know for a fact because I attempted to spend a New Year's at a hut a few years back where I showed up and started feeling unwell, managed to get norovirus, and then passed it on to about 18 other people that were at the hut. Sorry, guys. So again, this is going to be a bit more sudden onset, less than 48 hours after you've been in contact with someone else that's been sick or you had something under the water. Same symptoms as before, and filtration is pretty much ineffective against these viruses. So the reason that I just told you all about the different kinds of things that can cause diarrhea is because diarrhea is a huge problem causing dehydration. So dehydration is when you lose water from your body, and in exchange you have a relative rise in sodium levels. It's called hypernatremia. So when you're out in the backcountry, when you're out in the mountains, you're always losing water, and that's not uncommon. You're sweating, you're breathing, you're going to the bathroom. Usually you can replace your fluid losses, no problem. When you're going out in hot or really cold environments, you're going to lose some more water. If you're doing something intense, you're running a race or you're going for a big climb, high altitude, if you've got a burn injury, and if you're having vomiting and diarrhea. These are all other ways that you can lose a lot more water. if it's 20 degrees out and you're going for a moderate hike or something like that, you lose about 2 to 3 liters of water a day. This isn't really a problem to replace because if you're drinking water and you're eating snacks and things like that, you replace it, no problem. If you're drinking when you're thirsty, that's going to make up for it. But if you've got all these other things playing in, then it's a lot harder to replace your fluids, and you might need to do something a bit different. So some of the symptoms that you want to look for in yourself and in your trip partners is just how dehydrated they might be. When we're measuring dehydration, we look at the percentage of loss of body fluids and correlate that to the symptoms. And this helps us plan on how we're going to rehydrate that person. So someone who's mildly dehydrated, I'm sure that everyone's felt this regularly. You know, you're thirsty, you want to drink some water. You can also be a bit irritable, but there's nothing else really going on. If you have a moderate loss of fluid or dehydration, this is when you start to feel unwell. You're dizzy, you have a headache, you might not be thinking as clearly, you're not going to the bathroom as much, and your urine's really dark. And you just might not feel as strong and fit as you should be. When you get into the greater than 10% fluid loss, you're getting into severe dehydration, which is a medical emergency. This is when you start to lose motor function, you start to have some abnormal sensation to the skin. Level of consciousness can be decreased, and you can have changes in your vital signs. And any loss of fluid greater than 10% can lead to seizures, comas, or death because of the changes in electrolytes that are in your body. So the way to replace fluids, you want to start out easy. If you're just having some mild dehydration symptoms, you're just out for a run or you're going for a bike ride, you want to just replace with regular water. If you're having regular snacks to replace the electrolytes that you're also losing through your sweat, this will be no problem and the water's not going to be an issue. If you're just replacing with free water and you're not replacing those electrolytes that you're losing, for example, if you're going on a really big day or you're going on a really long run, something that you're over and above what you can bring in with food, or you're doing something where it's not possible to be eating, this is a time that it's a good idea to start supplementing with electrolytes. So I know I use Noon tablets. I know other people use some other powders that they add to their water. Something like that's going to work really well for sweat losses. Where it becomes important to start thinking about more serious types of oral rehydration is when people are losing their electrolytes through diarrhea and vomiting. You can lose way more electrolytes that way than you ever would with sweat. So the World Health Organization has created something called oral rehydration therapy, which they have been using to treat dehydration from diarrhea illness all over the world. So you can buy it, and it's pretty expensive, or you can make it at home. So oral rehydration therapy is based on the fact that there's a co-transporter that moves glucose and sodium into the cells. So whenever sodium moves across cell walls, water will follow. But you can't move the sodium without the glucose there. So what the oral rehydration therapy looks like is you have 6 teaspoons of sugar, half a teaspoon of salt, mixed with a liter of water. Using this, it'll give you the right concentration of glucose and sodium to move the water effectively into your cells. Obviously, if you're in the backcountry, you might not just have sugar and salt with you, but it's not that hard to carry. But you could improvise. You could use things like jam or honey. You can use things that you have that are sweet. You can use chicken stock or the bouillon cubes that you have for your dinner for the next night, things like that. You just got to kind of improvise a little bit. You may have to play with the ratio a bit, but I'm not going to say it tastes great. It tastes like salty, nasty water, but this is where we're going. Yeah?
Not that I like
yep.
go against the rehydration therapy,
Mm-hmm.
but there was a guy at Children's at the time of dehydration work, and he just had a study last month that was published. And they randomized kids to having like an electrolyte replacement, like a Pedialyte or something like that, versus apple juice.
Mm-hmm.
And actually found the kids with the apple juice came back to where it was had better rehydration. So it's really like whatever you put down.
Yeah. Okay. That's great to know. Awesome. I haven't seen that study. Sorry, but yeah. Okay. All right. So.
There you go.
There we go. This is a different one, but this is from. So we do have apple juice on this slide. I was just looking at, this is the level recommended by the Rehydrate group, but I haven't seen that study, and that this is a bit older data. So, So Pedialyte is an example of something that the WHO uses as an oral rehydration therapy, but it sounds like, you can improvise, and as long as you're replacing electrolytes and you're replacing fluid, you really want to just be treating that dehydration. So with mild to moderate dehydration, oral rehydration therapy and fluid is the main thing that you want to be using. So you start by replacing the fluid that's been lost. You want to start with giving people about 50 to 100 milliliters per kilo over the first 4 to 6 hours. So this could be a lot of fluid for someone that's a bigger person. You also want to add in additional fluids to replace their ongoing losses from stool or vomiting, and you want to be constantly reassessing the patient's hydration status. Also, if someone's dehydrated, you also want to be constantly monitoring their vitals because you don't want them to get into a dangerous zone. Once you've replaced all their fluids, you then want to start adding in food, and fluids can be maintained, and that's when, once they're eating, you can start using the regular water again. If they are continuing to lose any fluids from GI, so diarrhea or vomiting, you want to replace it with 10 mils per kilo for every stool. When you're replacing this fluid, don't give it all at once. That would be mean. You want to replace it in small, frequent amounts to avoid vomiting, because if you're giving someone a number of liters of fluid, it's not very pleasant. If someone's showing any signs of severe dehydration, you need to call for help. This is not something you want to be dealing with on your own in the backcountry. They're going to need IV fluid resuscitation, and you want to get help right away. Okay, so this is your turn. So you're on a 7-day backpacking trip in the Rockies, and your trip partner drank some untreated water from a stream a few days ago. So since yesterday morning, she's been having diarrhea. What do you guys want to know? Yeah, so we want to know some symptoms. Okay. So this is a 50-kilogram female. She's had 6 watery stools per day over the last 48 hours. She's not feeling well. She hasn't been eating or drinking, and she feels nauseous. She's got a headache, feels dizzy. Her heart rate's 95. Her rest rate is 18. She's got dry mouth, and her capillary refill is 3 seconds. So how dehydrated are we thinking here? Moderate. Okay. So with moderate dehydration, we want to rehydrate with oral rehydration therapy if it's available. So 50 kilos, 100 mils per kilo is quite a bit. That's 5 liters of fluid. Do you guys remember how much time we want to give that over? 4 to 6 hours. Okay. So if we're doing it over 4 hours, that's 1.25 liters per hour of fluid. So you want to give that in small amounts so that person is able to tolerate it, as well as replacing any fluid lost from stools. All right. So there are some contraindications to giving oral replacement therapy. Anyone that has an impaired mental status, so is at risk for inhaling any of that or vomiting. If they are persistently vomiting and they're not actually able to keep it down, that's another reason that you wouldn't want to give oral rehydration therapy, as well as anyone with severe dehydration, so showing any signs of vital instability or any change in consciousness. That person needs to be treated with IV saline before they can start on their oral rehydration therapy. So the take-home message for this part of the talk is just to prevent diarrhea illness in the backcountry, you want to use good sanitation and appropriate water purification for the organisms that might be in your environment. Oral rehydration therapy can be used for mild and moderate dehydration. It can be made from what you have in your pack, and you can substitute things in as long as you're replacing fluids quickly and you're giving lots of electrolytes. So the other thing I just want to push home is that severe dehydration is a medical emergency, and you don't want to be dealing with this on your own. If in doubt, call for help.
Okay, so for the second half of this talk, we're going to talk a little bit more about infections and wound care in out in the wilderness. And basically some of the takeaway goals that I'd like you guys to get out of this talk is to get a better understanding of appropriate management of wounds that we deal with in the wilderness, and how to manage them when we have limited resources and really only what's available in our pack. As a secondary side to that is to think about wounds that might have an increased risk of infection when you're out in the wilderness, and when you might want to get medical attention when you get back into town to get them checked up. So when I was thinking about this topic, I tried looking back at some epidemiological studies that to see what kinds of infections and things are often seen in the wilderness. There's a study published in 2007 from the National Outdoor Leadership School, which is based out in Utah and does a lot of gap year like trips with kids and education. And this is sort of a mishmash of all of the different types of injuries that they encountered over a 3-year period with on the trips that they did from their database. And I think the thing that I want to highlight is just how prevalent infections are amongst the different things that you can, the different injuries that can happen, whether it being nausea, vomiting, or diarrhea like Jenny has talked about, or even urinary tract infections or respiratory infections. A second study that I came across was published by a travel company out of the UK that does international expeditions is their sort of gig, and they published 5 years worth of data where with over about 4,000 clients that went on an estimated 1,500 expeditions, and these were sort of the top 5 categories of injuries and illnesses that they dealt with over the course of their expeditions. And for the purposes of today, what I'm going to be focusing on is really this third category of soft tissue injuries. And so you can see that, as we know, getting cuts and scrapes in the wilderness isn't necessarily an uncommon thing, and certainly the data supports that. Now, when we're talking about wounds and how we're going to go about treating them and managing them in the wilderness, you want to think about what our overall goals of healing are, because really we're trying to create an optimal environment for the body to do its own thing and allow it to heal as quickly as possible. So really there's certain things right off the bat that you have to take into consideration. If there's major hemorrhage, you're going to want to control that. But from there you want to do things that can help minimize the risk of infection with the wound. You want to, again, promote an optimal healing environment. You want to think about things like reducing discomfort and minimizing loss of function with with your colleague or yourself when you're out there, because oftentimes you are a distance away from getting a large center of help, and if you are immobile and are in a major amount of pain, it's going to create a longer amount of time before you can get back and get that attention that you actually need. So when we talk about wound healing, it's important to think about this natural response that our body's going to do and how it goes about healing wounds that go through it. And when we think about it at a biological level, there's 4 phases that go about with wound healing. So initially, when you have something like a laceration, you're going to go through this hemostatic phase initially, where you're going to be bleeding. You're going to have your blood products and your coagulation factors are going to come out, and you're going to be trying to form a clot in that wound. This leads on to sort of an inflammatory phase that goes over the first day to about day 3 to 5 of your wound. And what you're doing in this point is you're getting a recruitment of all your inflammatory markers, your macrophages and your neutrophils that are coming in and starting to recruit other cells that are going to release growth factors and cytokines to start precipitating this healing process. And as you can see, this picture on the right is what it looks like when you have a wound that's in this inflammation phase. This moves on into our proliferation phase, which goes from about day 3 all the way to about 3 weeks in time. From this time, you're starting to form this granulation tissue. So you break down some of that initial blood clot that was in there. You form something that's a little bit more solid. And what your body's trying to do now is you're trying to re-epithelialize the tissue that's over top. So we're trying to form those skin barriers back over top. We're taking this granulation tissue that's sitting deep down inside the wound and starting to turn that into more of a collagen-like matrix. And it's going to bridge and form stronger tissue. You're still at this point in time where you're somewhat susceptible, where this wound is certainly not nearly as strong as your original skin was. Which leads us into the third phase of healing that you see on the right, and this is the remodeling phase. And I think the interesting thing with this is you think, oh, when I look at a cut that I get, I'm 3 weeks later, it's fully healed. But really, this remodeling phase is just starting at that point in time, and really takes a full year before you are going to approach the regular tensile strength that your skin once had. The interesting part with any wound that you have is that your skin actually never regains the full tensile strength that once was there. It approaches more closely to about 80% of what was originally in that spot. So with an understanding of how the body's going to be dealing with a wound, it's important for us to think about the types of wounds that we might encounter, because this is going to differentiate how we might go about managing it with limited resources around. This Quinn et al. In Wilderness and Environmental Medicine published a really nice review article in 2014 that is worth looking up if you're looking for extra resources on this kind of topic. And they sort of broke down types of wound into clean, dirty, or contaminated. And as you can see from the table here, this can make differences in terms of how you might approach this from an irrigation point of view and from a closure of the wound. Interestingly, they don't give much in the way of categories in terms of discerning exactly what the difference is between a clean and a contaminated wound. I think it's safe to say that this relies upon a lot of our own judgment. We've seen wounds since we were a little kid, and that's probably it. Is a lot of it comes down to your own gestalt, that if you know that you have an infectious agent or were exposed to some sort of chemical, that's obviously going to be more on the side of a dirty wound than it is going to be to a simple clean knife, fine knife or paper cut. Now, when we look at these dirtier kinds of wounds, the one that I'm going to focus on today is bites, because this is something that does come up and isn't a potential hazard in the when you're out and about. So again, going back to some data, this is U.S.-based data on deaths by animal attacks in the between 1999 and 2007. And the most prevalent cause of death in the U.S. was other mammals, which is a very interesting category. They failed to describe what was included in this box, but I think the other takeaway ones are that dog attacks, as well as hornet, wasps, and bee stings are the most fatal causes of death for citizens in the U.S. And this is throughout any activity, so I'm sure the majority of this isn't occurring out in the wilderness. But with that, thinking about bites, my question to you is, what do you think the infection risk is with a potential bite injury? What do we say, A, B, C, or D? B? D? Above 30%. So I think the answer is it depends. Overall, with any bite injury, it's all a dirty kind of wound. This is a review paper that was looking at cat and dog bites. And as you can see, cat bites have the highest risk for wound infection. I've read some other sources that suggest that it's as high as 60%. Human bites aren't very good either. They supersede dog bites, interestingly enough. And a lot of this has to potentially do with the pathogens, but also has to do with the anatomy of the teeth. So cats, when they bite you, they give you a nice puncture wound that goes nice and deep, but doesn't leave a nice gaping hole on top. And part of the problem with this is even when you go to irrigate it, it's difficult to get out a lot of that bacteria that's seated deep down inside the wound and creates a nice environment for infections to propagate. So when we think of the overall infection potential of a wound, generally, if I get asked about this, I'm going to always go to my go-to is to think of Staphylococcus and Streptococcus species for just wounds in general. But when we think about bite-related wounds, there's always a few special organisms that can be a little bit more sinister. So for dogs and cats, we tend to think about an organism called Pasteurella. And what's interesting with these wounds is normally if you had like a surgical patient who has gone in for surgery, has an incision, if you were to see a post-op infection, you'd be sort of expecting to see that maybe on the early set about day 3 post-op, but probably more like day 5 to 7. With somebody who's had a cat bite, they can have the cat bite and they may not think it looks that bad, and they might come in and present and emerge 12 hours later and they've already got the brewings of a clear infection coming around that wound. So it's quite amazing to see how quickly the infection potential is with some of these animals, and certainly that's something to take away and think when you're out in the wilderness, that if you were to get bitten by something, you want to make sure that you clean it as well as you can, and that you probably will need to be seeking additional medical care so you can get this thing properly looked after with some antibiotic treatment, which most of us aren't going to be carrying around in a first aid kit. Now you might be wondering why I haven't talked about some of the nice little critters. I've talked about domestic animals, which isn't really cool for the wilderness environment. Now the thing is with these guys is there's not actually a lot of data out there. Most of it goes around case studies or case series, and a lot of the I'm sure a lot of the same bacteria with some other special ones come into play. But I think the obvious take-home message here: if you're bit by a bear, you probably need to go to the emergency department, right? Yeah. So there's other things that are going to be superseding the scale, and you might argue and say that dogs aren't really that like. What's the deal? They're not going to cause that big of a problem, and I would beg to differ. This is a picture of my wife. We like to go traveling overseas and stuff, and she has this this urge to touch any furry, cute animal that she comes across, regardless of what country we're in. And every time we have this discussion, no, I don't think that's a great idea. But I was trying to go through and find some pictures, and I came across about 15 pictures over like 2 trips that we had of her doing this. Luckily, she hasn't injured herself quite yet. She was stung by a stingray once, but no dog attacks quite yet. Although I'm expecting it will be forthcoming in the future. So even with bite injuries, there are certain things that might predispose you or make you think that there's an increased risk of potential infection. So really any dirty or contaminated wound that is overlaying a venous structure, some sort of lymphatic structure that might allow more propagation into other tissues in the body is going to be at an increased risk. Bites that involve the hand are at a higher risk. You've got a lot of structures in there that have the potential to get infected. We always worry about bites near prosthetic joints. We talked about cat bites. And then there's some obvious ones that if you have a delayed presentation and you haven't done anything with a wound and no bother cleaning it and wait 12 hours to deal with it, you're probably at a higher risk of infection than you are to somebody who cleans it right away. And then there's the other things like intrinsic factors, that if you have predisposing risk factors that make you immunocompromised in some way, you're generally at a higher risk of different types of infections. So when we talk about sort of complicating infections that might come on secondary to a wound or bite-related injury, the most common thing that I've seen so far is cellulitis, so sort of a patch-like rash that develops around the wound itself. Other things I came across and were reported in the literature, certainly things like abscesses are fairly common. In the hand, developing something like an infectious tenosynovitis, so of the tendon sheath of the hand, having those close structures can be a devastating injury that is going to need rapid antibiotic therapy. And then there's also these reports of less common things, so things like osteomyelitis that probably are more likely to develop with a crush-like injury that goes down to the bony structures, septic arthritis around joints. There's also reports of meningitis, endocarditis, a cardiac infection, and organ abscesses. So the other thing you got to think about with wounds is tetanus. This is a very common question when you come into the emergency department with any wound, is when did you get your last tetanus shot? And really it's the risk of tetanus, the report that I came across is there's 0.1 cases per million people. Probably, again, this is US data. Canadian data is always so hard to come across. And the reason that we do such a good job with tetanus is because we are for the vast majority well vaccinated and can receive vaccination prophylaxis when we present with a wound. But the thing to think about that's important when you're out in the wilderness is if you have sort of that moderate kind of wound and you're really like, well, 3 days, it's looking a little better. Do I need to go into emerge? This might be a reason that if you haven't had a tetanus shot in 10 years, that you might want to go see your family doctor and get that updated. because it can be easy to forget when you're back at the car after the trip's over. The other one is a little note on rabies. That guy's not going to do anything harmful to you, right? So this is a viral illness, has sort of an average incubation period of 1 to 3 months. It's a very rare but fatal. And I think the thing, we don't see a lot of it in North America, largely because the animals that we deal with on a daily basis, like dogs and cats, are all vaccinated against this. But in environments like caves, or with other types of rodents and other kinds of bite-related injuries, they become a little bit more of a risk. And it does take in some consideration for immediate post-exposure prophylaxis when you've received an injury like this. There's some WHO guidelines for this because they obviously deal with this a lot more in developing countries. But I think the key message is just if you've been bitten by a funny animal, it's good to go and seek further medical care and get their advice on the potential kinds of infections that you can develop, because again, these are things that we're going to poorly manage on our own with our limited resources and first aid kits that we carry around. So with being able to do limited stuff about treating an infection, what can we do to help prevent infections and appropriately deal with a wound when we experience one out in the wilderness? And really, this comes down to two different things. One, we want to do good wound irrigation, and we want to do appropriate wound closure for the environment that we're in. So when we talk about irrigation, I think about a wound, any kind of cut that I've had, and I can't remember when I've ever used a liter of any solution to wash it out. That probably includes running it under the tap for 15 seconds, which you think would probably get close to about a liter at that time. But yeah, it's large volume. So there's studies that have shown that larger volume does better than small volume. 1 liter seems to be sort of an acceptable number. There's not really any difference if you start doing gross irrigation at like 10 liters of fluid. But that's sort of what was reported in some of the review papers that I was looking at for this presentation. And then in terms of what we're going to do to irrigate that wound, what kind of solution we can use, really what you'll often see when from a first responder point of view or from a clinic point of view is normal saline. Now, I don't know how many of you carry a bottle of normal saline in your backpack when you go out on a trip. I know it's not going to be a great way. Maybe it'll rehydrate me well with the salt in there, but I'm not going to be carrying that extra weight around. Usually I reserve that for some wine or something, right, for the campfire. There's been some studies that have looked at irrigation of wounds with just plain tap water in contrast to normal saline with people that have presented with lacerations to the emergency department, and some multi-center studies that have found that there actually doesn't seem to be an increased potential risk for infection with irrigation with just normal regular tap water in contrast to normal saline. And so what about some other things that chemical antibacterial-like solutions that can, or antiseptic solutions that can really sort of clear out a wound? And I think the bottom message is that these things have gone out of vogue. When you have an open wound, these things might help acutely decrease the bacterial load that you have deep down inside of a wound, but there's actually been some suggestion that at 48 hours later after you've cleaned out that wound, the bacterial load will be actually higher than what it was initially, which is quite interesting. But the most important part of trying to stay away and only use these for appropriate situations, like there's obviously a use for everything in certain situations. This stuff can be necrotic to tissue. So again, in trying to help and promote that healing process, we want to create that optimal environment. And this is actually going to be destructive to some of those tissues and that granulation tissue that's trying to lay down and form and go through its normal healing process. And we're counteracting that by using things like this. And again, this adds extra weight if you're thinking about taking it out with you. So the last thing is what pressure do we want to irrigate a wound at? With what I was reading, we're aiming for about 6 to 15 psi. what the hell does that mean? The way that looking at different sort of ways of generating that kind of pressure, the best way to do that, and simplest way that I thought that might be worth potentially incorporating into a first aid kit, is just using something like a 35 mil syringe with a 19 gauge needle tip. That generates about 8 to 10 psi. Granted, that's sort of what's coming out of the needle, and what actually hits the tissue might be less than that. But certainly it's better than sort of drizzling your Nalgene bottle over top of the wound. And when you think about using something like this, like, you're going to be doing that quite a bit if you're trying to do 1 liter of fluid, and it's going to be a diligent effort, and you can see how much work you actually need to put into it to properly irrigate a wound and create that optimal environment. So the last part of it is, how do we close a lacerated wound? So when we think about closing a wound, we can do primary closure, secondary intention, or delayed primary closure. So primary closure, you go in and somebody sews up your wound. I don't carry suture material. My suturing is very suspect at best. And I'm sure a lot of you probably aren't carrying that kind of material in your first aid kit when you're out and about in the wilderness. So really, just primary closure isn't often a viable option for a lot of wounds that you're going to be dealing with. Other things that you may have available to you are things like steri-strips. Now, steri-strips are, in theory, great. You can approximate edges of a wound that's not under tension. That's a big caveat, which unfortunately a lot of them are. The biggest downfall to steri-strips in acutely managing an open cut is, I get sweaty when I'm hiking, and those things just slip right off. Right? They're all next to impossible to use. So really, they don't stand a practical chance in helping you to keep a wound nicely closed if you're going to be having to hike out on it or manage it for multiple days. So then that leaves us with sort of secondary intention and delayed primary closure. So secondary intention is nicely pictured here, and that's just sort of allowing the body and creating an environment to allow it to do its sort of natural healing, build up a clot and form a scab and cover over. You don't really get as nice a looking wound by the end of it, but certainly that is a viable option. Another option is delayed primary closure, which is quite practical for the wilderness environment, where you're usually not like weeks away that a wound's going to completely heal. That you probably are a day or half a day away from going to get that looked at. And so that would be just going in later on, and they'll degranulate and debride the wound, and then they can close it at a later date. So then when we're thinking about things like delayed primary closure and sort of healing by secondary intention, we ought to be more focused on how are we going to dress and keep that wound clean after we've irrigated it quite nicely. I think there's been a shift, or the original thought is we take a clean dry dressing and you plop that on the wound, let the blood soak through, put another one over top, and just sort of keep going and packing that stuff on. And that doesn't necessarily lead to creating an optimal environment for prolonged use. So really we want to create a nice moist environment for the wound, and actually the healing tends to do better in this environment. So the idea is that if you can take things like clean watered soaked gauze and place that over top of the wound, and then cover that over top with dry wound, is a better way to layer your wound and create a better bandage. Things that are going to be deep and might need some packing is kind of a more advanced wound care technique, but in certain situations with more severe substantial wounds, that might be needed. But at that point in time, you might be looking at calling in more cavalry to come help you out. Obviously, clean dressings, that's a pretty, that goes without saying. There are some other things like topical antibiotics. Certainly common knowledge to me until I was reading about this a little bit more would be if I have a cut, well, I just put some polysporin on it, it's going to heal faster. And actually, polysporin kind of in the early stages of wound healing acts like some of chlorhexidine and those other things where it destroys some of those tissues that are trying to be laid down. And really you probably want to wait more into a little bit of the later stages of the healing process. There is also some controversy as to whether, if you don't have an infected wound, do you need to be putting a topical antimicrobial on the wound if it's not infected? And the answer is no. If you don't have an infection there's not really anything to treat. It's keeping it clean. So again, thinking things like clean water, that's sort of the way to go. Just as a side point of interest, I was reading some stuff about honey that was come up. There's some, I guess this was has been used in the past for historical times, and there is some evidence that medicinal grade honey can be beneficial. Although, as you can imagine, there's not a lot of huge evidence. I did find a systematic review, so there obviously are enough papers out there, but I think most of you aren't going to be carrying medical grade honey along with you. You'd be the honey that's in the jar, and I don't really want to comment and advise that that's going to be practical for helping you with your wound care. So overall, the take-home messages from this point: when we think about managing a wound in the environment, make sure we give it a good wash. Hopefully I give you some principles and some things that you hadn't thought about previously. We also want to give the body a nice, clean, and moist environment to work with. And then finally, we want to recognize wounds that have an increased risk for infection. So this includes contaminated wounds, which you can use your own gestalt to figure out if that's contaminated versus clean. And then with bites, you probably want to consider leaving that wound open until someone else can have a look at it, as there is an increased infection risk by some of the statistics that I showed you. So if there are any questions, yes.